some of the ways that also patients can receive different behavioral therapies, such as CBT. The gut-directed hypnosis, I'm going to touch on a little bit as well. So some of our scalable solutions in terms of digital therapeutics out there include NERVA. So NERVA is an evidence-based gut-directed hypnotherapy program. It is self-directed, so there's very low risk typically with these, outside of those disclaimers that I mentioned earlier. So with any of these digital therapeutics, if a patient has more severe mental health symptoms, we would recommend more comprehensive treatment. But what's fascinating about these digital therapeutics and the research that is coming out about them is that in NERVA's case, the efficacy was very similar to in-person treatment for IBS. So an 80% response rate, a 75% reduction in their IBS symptoms. And what's also interesting about the digital therapeutic space is their go-to-market strategy is very different. So NERVA is not FDA approved. It's something that a patient can download on through their app store. They pay for it. They have a couple different pricing structures. So it's about $69 for a 3-month subscription or $149 for an annual subscription. But again, this is a pretty low risk treatment for patients with IBS. Another digital therapeutic out on the market is Zemity. It's a self-directed CBT program with some hypnotherapy modules. It's about a 6-week program. Clinical trials, again, show efficacy. There's about a 66% reduction reported in IBS symptoms. And in this case, patients also have access to a health coach for a fee. So there's about a $20 a month fee, or there's a $49 for 3 months program. And then accessing that health coach is going to be between $100 and $150. And the last digital therapeutic that I'll mention today is Mahana IBS. So again, this is not an exhaustive list. There are others that are coming to market, but Mahana IBS is an FDA cleared product. So this is prescriptive CBT for IBS. It's personalized treatment program that a patient will follow, again, in a self-directed way. They have access to the program over the course of 3 months. It takes about six weeks to complete the program, but then they would have access to continue to utilize over the next several weeks. Mahana participants had clinically significant improvements in about 60%, and that was durable at 3 and 12 months in research studies that they've shown. So again, in this model, the gastroenterologist is actually writing a prescription for this behavioral therapy utilizing GI-specific cognitive behavioral therapy. And so it's a different go-to-market strategy than some of the others.